obviously the nurse will come out and call you. That's a good sign. They physically walk out to the room and they call you, not like way back in a room somewhere. I've had that happen to me before, and just sitting there wondering, do they still know that I'm here? So that's another good sign. Um, yeah, so once the nurse calls you back, um, they usually take your vitals, they check your blood pressure and the normal stuff, your weight, your height. Obviously for me, most of the time they don't need to do that because I'm pretty small. They kind of look me up and down and just like, okay, let's just stick to the weight. Um, so yeah, weight, temperature, blood pressure, the normal stuff that they do. And then, the nurse will ask you a little bit about yourself. If you're feminine, they'll ask you. If you're female, they'll ask you about feminine things. Um, and they'll ask you, about your complaint. How long you've been feeling, the issues with your back. Did you just bend over and all of a sudden, you can't stand up? Um, they'll just ask you a little bit of details. They'll probably go into your history a little bit and put things on the computer, or they'll just write something down real quick, make a quick note for the doctor. And then, if they're nice, they usually, they'll make small talk, or they just sound pleasant, and they kind of seem like they want to help you out. A bad sign is when they just come in, they don't greet, they don't tell you who they are, um, and they just right away just start asking you, what's the problem, and no eye contact, and they're just like filling out their paperwork, and they just right away start taking your signs. They don't tell you, okay, I'm about to take your pressure, or I'm about to. They don't do that. They just are just doing things to you as if it's just a regular day routine for them. Those are not good signs. Um, so hopefully, like I said, this will help you out to kind of sort through some of the good people. And obviously, once the nurse is finished, she'll leave or he will leave, and then the doctor will come in. You know, after a few minutes, sometimes 10 minutes tops. Um, they'll come in. That's a good sign. And then they should greet themselves. They should tell you, their name, and they should say hi and or good morning, whatever they do. And they should ask you what's going on, or if they've already been looking at the notes, which is a good sign. They'll say, oh, well, I see that you've been having some issues with your back. That's a good sign that they did a little bit of research, or they looked at your case before they actually walked in. But if they don't, it's still okay. It's not bad. They'll ask you what's going on, and then they'll do their own little, they'll do their checkup. They'll see what's going on. They might test your pulse. They might check your responses, not your pulse. Sorry, they'll check your responses. They'll check to see how the back feels. They'll do what they do, what doctors usually do. But normally, what they'll tell you is you have to get some X-rays, so that they could see what's going on. That's really what they'll tell you. Well, maybe MRIs. They'll write a script, or if you need a referral. Some people don't need referrals, but they will tell you that you need to go see a specialist. So that's usually the end of that visit. And then they'll tell you, once you're done with those results, they'll have them faxed to that doctor, your original doctor, and then you can discuss what you're going to do. Sometimes those doctors will try to write you a quick prescription. That's not good. If they're just like, okay, let me write you this quick prescription, here, this will take care of the pain. Usually that's just because they know they're going to get paid extra for that kind of stuff. They're not concerned about, what else is going on with you. But if that's not the very first thing they do, or, trying to, sell you more stuff, if they don't do that in the beginning, that's a good sign. If they're trying to get you to see what it is physically wrong with you, then that's good. So once you're done with that, and they tell you you do need to get some X-rays of your back to come back to them. then you follow up with that. You kind of go research. Sometimes a doctor will have their own list of people with their clinic or with their group that they recommend to you. Sometimes you can do that and it'll process faster, but I like to, like I said, research and see what's going on. I want to know if this specialist, you know, if, like I said, all the things I said before, where they work, how, all these things that I listed before. I check that stuff out so that I know I'll check their things out too. But yeah, so when you actually go to your next visit, same procedure. You call them up, do the same things like I said before, and then you get there. Make sure you're dressed comfortable. They tell you dress comfortably for your X-rays or MRI, whatever it is that they recommend. um, Try not to be too stressed out about that, because if you are getting an MRI, some people are claustrophobic, or they're kind of scared about that. um, Try to do the best you can to get through it. I actually slept through mine. I went in, I had some sweats on, and I don't really mind that stuff. And I kind of I kind of was sleepy that day, so I think that kind of helped. But I was a little nervous. But once I got into the room, I already knew. I kind of prepared myself. I need to get this stuff done. I need to find out what's going on with me. So I kind of just went in. It did take forever, and I did fall asleep. But the person woke me up, and they prepped you. They tell you, do not move. Try your best to be still. You can't wear any jewelry, anything like that. You have to have that stuff removed. Um, let's see what else. Yeah, so pretty much that was it. My whole experience, I just slept through it, and it wasn't that bad. I've had MRIs done before. I've had the X-rays. I just kind of walk up to the screen, and they just take a quick, body X-ray. I've had other things done, but yeah, so that was my experience. If whatever it is that you can do, if you want to picture yourself someplace nice, or if you don't really sleep that much, that would be the opportunity to get some rest. So anyway, after all of that stuff is done and they send back your results to your doctor, yeah, they'll speak to you about what kind of things you should do. um, at that point, those results should be going also to the specialist. um, a doctor that specializes in your back. Can't remember the name right now. Maybe it's an osteo doctor, something like that. But yeah, I went to that visit. I didn't like the one that I went to. That was a bad experience. He was kind of like, he was an older person and kind of cold. He wanted to prescribe um, injections or some kind of like shot. He took me to another room where they had their specialists do their tests to, they ran through, and it was such a long time ago. Um, I should really go through my paperwork to see exactly what they did, but I did go into another room where they did take some images. And then that specialist, was talking to me about what he saw besides the other images that were already taken. Um, so he did tell me, that I had, spina bifida, scoliosis, and, mainly what was new was the DDD, which is the degenerative disc disease. So with this doctor, I asked him at that point, I kind of was just in so much pain that I asked him about, getting some kind of surgery to fix the pain because it wasn't going away. It was taking so long. And at that point, I kind of, I didn't really know all the things that I should have been doing with my body, as far as health or, food. I didn't know anything. It was kind of like a new experience. So I just wanted to get some surgery done and just get it over with. So with him, he told me I can't have any surgery done. It's not recommended. My case is not that serious, and it's a possibility that if you do get surgery, you might not be able to walk, or something else might be wrong with, some other negative thing might result from having that surgery. So that kind of like threw that out the window. I wasn't going to go through with that. So I asked him, well, what else is there to do? Because I don't want to take the surgery, and I don't want to take all these prescriptions that you're trying to make me do, because I've heard other people say if they take, you know, I'll have another video about, pain management meds and things about that. I'll talk about that more in another video. But, fast forward, he did say, I'm just going to have to do physical therapy, and that's pretty much all. So I felt like I wasted my time there, but really, it was a good thing, because the physical therapy did help me. So after visiting with him and realizing I wasn't going to do either one of those things, and like I said, going on and looking to see what physical therapist I could go to, and I did go through I think two or three because of the experiences. And when you do go to the physical therapy, they will, do certain things like hook you up to a machine that has like these little, I think it's called a TENS machine. It has these little like long wires, and they stick them to your back, and it kind of like, um, it's a stimulator. It stimulates the muscles and the nerves, and it kind of loosens them up. They help you, and you do really feel so good afterwards. It's like, I don't know, if you've never had it, it's a really good experience. But so yeah, and when you go to physical therapy, there are, I think usually about 6 to 8 um, sessions that your insurance will cover, or that they'll recommend that you go through, and then they'll break up, what they do during each of these sessions. They'll have different exercises that you do, and they most of them have all these weird names that I can't even really remember. I'll go do some more research when, I'll talk to you in another video about different exercises and the moves, and we'll get more into that in another video. But yeah, so during my 6 to 8 sessions, I didn't make it through all the way on my first physical therapist because I didn't like the experience there. But they did help me out. I went through another one, and that was more of a private session. That first place that I went to, it was like this open place. It looked like a gym. You walk in this big room, and there was like no real partition. I think they had probably like two small rooms, like where you can go in, but they had one table, or they had two tables on the outside where you just lay there, and other people around can see you on the table while they're, helping you with your moves, or putting the heat, or the hooking you up to these different things. And I didn't like that because there was no privacy. I think at one session when I did complain, they did put me into a private room, and they kind of left me there to just do my moves by myself. They said, okay, here, we want you to do like 2 reps of this, like 15 times, do this. Then they walk out, and then they'll come back, and how do you feel? Meanwhile, you're not watching me to see if I'm doing the moves right. That was a revolving door kind of place. I don't even remember the name of that place, but I think they still do send me emails to come back to them. So anyway, yeah, I did learn some moves, and at the end of each of those sessions, they would print out some sheets of, with images, animations of what I needed to do with the reps. They told me, once you go home, make sure you're doing these throughout the week, until you come back to your next session. So that was that place. The other place that I went to, it was a little bit more personal. They didn't have, like this big open space. They did have an open space, but when they were working on me, on my body, they had me curtained off, privately by myself. But when I was doing more strengthening moves, obviously I had to be on those machines where, you know, kind of like a workout place, you know, where you work your back, you know. And this person actually showed me how to do other things like strengthening with, um, you know, the weights, and not like bodybuilding, but you know, she would kind of go through what the, you know, what was good for me with, as far as, you know, how much I could take. You know, she would explain, you know, not to like kind of force too much on and she watched, she was standing there, she watched me, she made sure I was doing everything the right way, made sure that I was moving the right way, you know, so because she didn't want me to hurt myself, you know, so that was a good sign. So I think that's pretty much it as far as doctor's visits and physical therapists. Yeah, so make sure that you're doing all those things before you actually go. And then I hope, you know, you have a good experience when you go. And please, I hope that all these things help you to, you know, get your back, your spine together. Okay, I will have more videos to come. Hopefully, this wasn't too long or too boring, but I just kind of wanted to get out, you know, what it is like to have this, the first part of, you know, getting checked out and knowing what it is that is wrong with you. So thanks for tuning into my channel. Please subscribe to this channel. I need to build up my subscriptions. And please like if you found anything interesting or if you learned anything new. Please like this video, and please send me some comments to let me know what else I can do, what you're interested in knowing about, what it is that I left out of this video, if anything, because I spoke so long. And thank you.